went to school at the University of Virginia for college and for medical school, and I did my surgical training at a combined plastic surgery program in Allentown, Pennsylvania. I am board certified by the American Board of Plastic Surgeons. I am a plastic surgeon, and I love surgery when it's the right thing to do. I've been in Savannah since August 2002. And some of the things I'm going to talk about is how to protect the skin we're in. It's really important for us to prevent what we can and to avoid premature aging, and how to age gracefully, which is very individual, and how to treat sun damage. Damage happens by degrees over time. It doesn't happen in one day, and often we can't fix it all in one day either. But we know that one blistering sunburn doubles our risk of melanoma, and lots of little burns over time increase the risk of basal cell carcinoma and squamous cell carcinoma. I do recommend that everyone have either their medical doctor or a dermatologist do a skin check from their scalp to their toes and everything in between, so that we're monitoring and avoiding things as best we can. And if you see something before your appointment, don't wait till your next appointment to get it checked. Get it checked on early. The smaller things are, the easier they are to deal with. When we're exposed to the sun over time, it accelerates the aging process. This is a guy who drove with the window down on one side, so the roof of his car blocked the sun on one side for almost 30 years of driving his truck. And the right side of his face looks about 30 years younger than the left side of his face. So this is how dramatic the changes in the tissues and the loss of elasticity that sun damage can cause. Acne and rosacea. Acne in the adult is not always acne. A lot of time it's really secondary to the inflammation and damage in the skin. One of the common ones is rosacea. And many adults who are trying to treat their acne are pouring fuel on the fire. If you're using things like benzoyl peroxide and salicylic acid and they are making your skin worse over time, then it's not what you need. And so there are a lot of other things we can do to improve the health of the skin, and then suddenly your acne gets better. Aging gracefully really is an individual decision. For some people, it's I earned all my stripes, I'm going to keep them all, or I earned every line that I got. And for some people, it's doing lots of things, again, in very normal, natural ways. The most important stuff is to take good care of ourselves and eating well and getting all the building blocks that we need. Then, if it makes sense to you, it's taking advantage of the techniques that we have available. And I decided to become a plastic surgeon when I was 2.5. It was my first trip to the emergency room, and I could show you the scar. I could see what the plastic surgeon was doing in his glasses, and I thought it was pretty cool that you could help people when they did really silly things to themselves. And when I was growing up, I had really, really significant acne. I was on Accutane twice as a teenager. I had lots of scars, and like many acne sufferers, I treated my skin with the sun. Because what we know now is that the immediate effect of sun exposure is it dries up your acne. The delayed effect about 3 weeks later is that the UV radiation actually increases your acne over time, so it creates a vicious cycle of acne for people. After I became a plastic surgeon, I had 2 babies, and they are gorgeous, beautiful girls, and it did horrible things to my body. It was awful. I had an emergency tummy tuck, I'm telling you. So it really did, as a plastic surgeon, I do this all the time, and I had really significant changes from having babies. It really made changes in my body that made me unhappy. So I listened to my own advice. Why live with it when we can fix it? So I had a tummy tuck, and I had a breast reduction, and then I had the muscles put back together, had the excess skin removed. So I can tell you both as a physician and as a patient the kind of really dramatic changes that we can make in the body with surgery. It is the right tool for that problem. For the face, I had all non-surgical procedures done, and I had the sun damage. I treated the sun damage with Levulin. I treated the color with Trinity. I've treated the early laxity with Ulthera. I've treated the early volume changes with fillers. So I've done all this stuff that I'm about to tell you about, and I'll show you some of my pictures. I'll be at parties and people will talk to me and say, forget surgery, but what can I do about this? What can I do about this? People are scared of surgery. They're scared of looking different. They're scared of looking overcorrected. People want to like what they see in the mirror. People want to be comfortable without having to wear makeup to go out in public, to look normal and natural, and not look like they've had a bunch of stuff done. Myths about surgical options. One of the myths is, why don't I just have a facelift? Because a facelift doesn't fix all the things that happen as we age. And on the opposite end of it is never have a facelift. That is not what I'm saying. There are some things that I can't correct without doing surgery. That doesn't mean we have to go there, but we have to talk about what we can do and what we can't do without doing that. One of the myths about Botox. Botox only makes you look frozen if you use too much of it. So if you completely eliminate all of the action of your muscles, then you look frozen. Is she happy or sad to see me? I don't know. So the goal is for you to still be able to scowl at your children if you need to, but not look like you're sad and tired all the time. And fillers make you look fat. Fillers put in the right place can actually make you look more slender because they're lifting and creating those angles that we used to have. If you put it in the wrong place, then yeah, it makes you look fat. It makes you look like you're storing nuts for the winter. So we want to avoid those things. And the older skin lasers did have, some of the old technology really did make people look waxy and unnatural. That's why we have newer devices and newer technology that is designed to stimulate normal collagen as opposed to the old CO2 lasers that stimulated scar collagen. So we want to keep it normal and natural looking. And there are procedures we can do with a little bit of downtime if you want it, and we can do it more delayed gratification and gradually over time that have no downtime. So in my opinion, a lot of the trouble that happens with patients is because they aren't able to, they don't understand what's going on and they don't know how to communicate to their surgeon. So my job is to help people understand what's going on with their face so that they can know what questions to ask and get what they're looking for. So the face has 5 layers, from the outer surface to the bone, and then the tissues in between, okay? So the skin has developed sun damage, it loses collagen and elastin. The deeper layers, the bone and the deep structural fat, are where we lose most of the deep volume of the face. And by restoring that volume, we recreate the natural look. There are lots of fillers available. Restylane and Perlane and Juvederm are hyaluronic acids. It's part of what we lose as we age in the soft tissue of our face. Radius is it's calcium hydroxyapatite. It's actually one of the components of bone, so it's fabulous for recreating bone projection and restoring volume there. Sculptra stimulates collagen production, so the filler is actually your body's collagen, which is nice and soft and natural feeling and useful for a lot of places there. Artefill is very long lasting, and fat is where we take it from a trouble spot and we put it where we want it. And the newer techniques with that are beautiful. But those are more permanent, long-lasting restorations. I don't recommend that people start with that until we know that we're on the same page and you love what I do. Then we can commit to something longer lasting for you. And this is what I'm talking about. On the left side of her face, she hasn't had any filler yet. On the right side of her face, she has. So if you look at her nasolabial folds, you've got a very significant difference in her folds. And in her cheeks, she's got a nice difference in the appearance of her cheeks. And if you look down her neck, she's got a very subtle but real difference in how her neck drapes. So this is mid-procedure after I've treated the right side of her face. In that picture, the only place I've put filler is from her brow up into her hairline. So I haven't touched her nasolabial fold, but by restoring the scaffolding to her face, restoring the deep structure, it restores the height back to her face and leaves it looking very, very natural. And many patients are fearful of lip filler because they've seen the trout pout and they've seen what Hollywood thinks is a beautiful pair of lips, and know that I don't even know what they do to make that because I haven't taken that course. I don't believe in that. What I want is for people to have this lady has a beautiful smile. She's lost projection. She's got the little vertical lines. By restoring the volume that her lips have lost, she gets that nice projection, but she doesn't look like her lips are dragging her in the room. She looks like her lips are just built that way. And then Trinity, I alluded to that before, it's color correction, wrinkle reduction, and collagen and elastin building. So we're restoring normal collagen, restoring elasticity to the skin, and building back the outer surface of the skin to tighten the pores and even out the surface. And this is a patient who's a year out from her 3 treatments. She was actually coming in for her touch-up to maintain the changes that she got from it, but she's had 3 treatments of color correction and that restoration in her skin. And this is a patient who had very severe rosacea. She was treated with a combination of Levulin and Trinity together, so that we're reducing that red, we're improving the scars. In someone as severe as this, we're not going to completely cure this, but we're going to keep it at bay and keep it under better control with that. PDT is the Levulin treatment. We can do Levulin with just by itself with the blue light, and then we can do Levulin as a combination treatment with Trinity to get the more cosmetic improvement, and then Ulthera is that deep tightening treatment. So this is an Ulthera patient that you may recognize around here, and this is her before and after with her change in neckline. And this is an older patient with a history of smoking. This is her 3-month change, and just a brightening of the skin and an improvement in the neckline and around the eyes as well. And you might recognize this one too. I was 40 when I had it done, and I was starting to have some changes in the neckline, just drifting downward, and a laxity around the eyes and brows. And this is a patient who had filler. This is, just to clarify what this picture is, this is her right face before the treatment, and then the right face flipped over. So you're looking at the same cheek before and after the treatment. So that's putting filler up on her forehead, and restoring that volume. So again, the improvement in the nasolabial fold in the corner of the mouth is all from putting that filler up where it belongs.
Contact Dr. Meghan McGovern at Coastal Empire Plastic Surgery today to learn more.